Good afternoon, everyone. Thanks for joining us. We're just going to give it a couple minutes to fill the room up here. Afternoon again, everyone. Thanks for joining us. We'll give it another minute or two here to fill the room. Yeah, good afternoon, everyone. Thanks for joining us. We'll give it about 30 more seconds here to fill the room. Okay, good afternoon, everyone. Thank you for joining us once again for our now weekly Wednesday webinar series. Today's webinar is on new directions for 2021, State of the Foundation. My name is Brett Spitali, and I'm the Vice President of Advancement here at the National Hemophilia Foundation. At any point during the webinar, if you'd like to ask a question, please use the Q&A feature at the bottom of your screen. We have NHF staff members monitoring these questions, which we'll post to the panel after the presentation. This webinar is being recorded and will be available to the community beginning on Friday, January 15th. I'd like to introduce Len Valentino, President and CEO of the National Hemophilia Foundation. Thanks for taking the time to join us this afternoon, Len, and I will now turn it over to you, sir.
Thank you, Brett, and good morning, good afternoon, and good evening to all of our attendees. I'm really excited about the new webinar series that we're going to be holding weekly. We plan on having a variety of topics, some presented by NHF staff, but I think more importantly by invited speakers from the community. So if you have ideas about topics that you'd like to hear about, please let us know. So without further ado, we'll go to the next slide. And I'd really like to take an opportunity to ask everybody to reflect back on 2020, the challenges that we've all had, but also the opportunities that we've had. But I think it also deserves a moment of reflection for all the members of the bleeding disorders community who have left us in 2020, either because of COVID or disease-related complications. But losing a loved one is always a challenge for anybody. So I'd like to just take a moment of reflection and ask everybody to pause and think about loved ones or community members that we've lost in the last year. Thank you for that. I'd also like to recognize the more than 360,000 people in the United States who died because of COVID. And you know, there's choices that we all have to make. And I think if we want to have a different outcome, we need to make different choices. So we're going to begin and talk a little bit about NHF's core values. And they're listed here. And I think it's really important to understand that we operate for the purpose of our community. And we are here to serve the bleeding disorders community and every member of the community above all else. We have a commitment to the community members. We have want to demonstrate compassion and diversity, integrity. And I think it's really important that we also have a level of transparency with the community. So if you believe that NHF or any of our members are not exhibiting these core values, I'd like to know about that. And I think it's really important that we all keep this in mind as we deal with each other, but more importantly, with internally as well as externally with our community. So again, you know, we have core values and I think we have to abide by the core values, but not only abide by them, but really embrace them. And I ask everybody in our community to really think about that and these types of core values in your daily activities. Next slide. So one of the challenges that we've had is creating a vision for the future. And the vision that we wanted to create is not a short-term vision, but really looking over the long term, over the next decade. So we began in 2020 with opportunities to begin to develop a vision for 2030. Next slide. And that vision has really culminated in a change in our vision statement. And many of you may not have seen our new vision statement, but here it is. And it's a world without inheritable blood disorders. And I think it's really important to emphasize two parts of this. One is the focus on cures, eliminating inheritable blood disorders, but then also consistent with our core values is being inclusive. And we believe now, after listening to the community in multiple different venues, that we need to be more inclusive of the entire blood disorders community, not just bleeding disorders. And that includes people who have platelet disorders, venous thromboembolism, sickle cell disease. We need to be encompassing and embracing of all aspects of the blood disorders community. So our vision for 2030 is really to begin our work to embrace all of these communities, bring them together. I think we had a wonderful beginning to this vision with the pre-con session that was held at the Virtual Bleeding Disorders Conference in 2020, where we brought together other blood disorder groups for discussion. And we plan on continuing doing that, where we can support, nurture, and work with all of these other disease state organizations to advance the care through advocacy, education, and research of all of these disorders. So our vision really is one that is a work in progress. We're clearly not there in 2021, but this is our vision for 2030. Next slide. I wanted to also make a comment about our mission statement. So the National Hemophilia Foundation is dedicated to finding cures for inheritable blood disorders and to addressing and preventing the complications of these disorders through research, education, and advocacy, enabling people and families to thrive. Now, a few comments about our new mission statement as well. You see there that in the second line, dedicated to finding cures. And I think that's important, consistent with our vision statement. We want a world without inheritable blood disorders. So finding cures is really going to be a major emphasis for us, working with the community to define what those cures mean. And again, the third line, inheritable blood disorders, expanding our reach and our impact to all people with benign blood diseases. Then you can see in the fourth line, addressing and preventing the complications of these disorders. Again, we're not going to leave people behind as we focus on a cure. We need to continue to care for people in our community, no matter what their problems are, whether that's joint disease or hepatitis or other complications of disease, age-related comorbidities. We're going to continue to focus on addressing and preventing complications of inheritable bleeding disorders, and while we expand to inheritable blood disorders. And then I think the second line from the bottom is also important. We've changed the order. Research, education, and advocacy is now the order, as opposed to what we had previously. This emphasizes the important focus that we're going to have on research, and we'll talk more about that as the presentation goes on. And then the last line I think is critical, enabling people and families to thrive. We chose those words very carefully. Thrive is we want the best for our community. We want people with inherited blood disorders to be the best that they possibly can, and for their families to be the best that they can, to live the richest, the fullest, and the most fulfilling life that they can. That's what our organization is about, and how we're going to try to meet that mission will come in subsequent slides. Next slide. So I wanted to make another statement about our diversity, equity, and inclusion program that we're developing. Many of you might have heard that we're in the process of recruiting and hiring a leader in our organization to head up our diversity, equity, and inclusion program. This will be not only an internally focused position, but more importantly, externally facing, to take on the challenges that our community has in terms of diversity, equity, and inclusion, ensuring that people who are affected with inheritable blood disorders have the services that they need so that they can have the best possible life achievable. We want to do that regardless of age or color or disability or gender identity, gender expression, family status, national origin, race, ethnicity, sexual orientation. And we've created this diversity statement by listening to our community. We believe that every person's unique perspectives and experiences helps us advance our mission. So again, I ask each of you to tell us what we can do to help in terms of diversity, equity, and inclusion, and how we can overcome some of the social determinants of health that have impacted our community in a negative way in the past. We really want to make an effort to support our community so that every member of our community can thrive. Next. I wanted to make a real comment about our board of directors. And we have an outstanding board of directors, and their names and photographs are here. I want to mention that we have 3 new board of director members that I'm really excited about, along with our new NYLI ex officio member. Eileen, Paulette, and Kai are new members of the board. I'm really excited to have these individuals as part of our board to join the already very strong board members that we have. Dr. Bryant brings a wealth of experience in the medical community to us. Kai Brown has been in industry outside of bleeding disorders and brings a tremendous amount of business experience and acumen to us. And Eileen San Juan has really been part of our community in the past. So I welcome all of them to the NHF Board of Directors, and I'm really excited about working with every member of our board. A special mention about Ali, who's our NYLI representative. Again, we feel that the future of our community is in the hands of the young people. And we really look forward to our NYLI program, helping develop and nurture those young leaders of the future for us. Next slide. So the key activities of our board are seated or rooted in the governance model. And the board's responsibilities are around establishing global ends. Global ends are incredibly important, and we'll talk about those in a second. They provide support and oversight for NHF as well. And they ensure that we have the necessary resources and financial stability. So the board plays a critical role in our ability to execute on our mission and vision statements. Next. So individual board member responsibilities have a number of things that they pay attention to. Next. So they act in accordance with leadership standards. And on the next couple of slides, we'll go through what those are. Next. So they care of duty is important. Board members must stay informed and ask key questions. They must listen to the community. So I encourage each of you that are here listening today to interact with our board members. They need to hear from you so that they can be informed about what the issues are. Next. Next is a duty of loyalty. The board members show undivided allegiance to the organization's welfare. Again, that's to the mission and vision of the organization, and they need to provide us with that stewardship. Next. And finally is a duty of obedience, to stay faithful to the organization's mission. We need to have strong board members, and I believe that our current group of board members are as strong as we possibly can. Could we have additional people in our board that would bring expertise? Absolutely. And I look to each of you listening today to think about other people in our community that can be nominated for a board position next year. We have board members who are always leaving the board as well. So we're always in need of new talent for the board. So I would ask our community members to be thinking actively about potential board members for the future. Next slide. I also want to talk a little bit about who we serve. Of course, we serve the consumers of healthcare. Currently, there's more than 100,000 unique patients that have been identified through the Centers for Disease Control and Prevention patient profile that's supported by the American Thrombosis and Hemostasis Network. I think it's really important that we know that there's 100,000 people out there, but we have only a fraction of those who directly interact with NHF or with our chapters. We need to do a better job of being inclusive and bringing all people with inherited bleeding disorders into the NHF and chapter family. What about our chapters? We now have 53 chapters, of which 7 of those are legally part of the National Hemophilia Foundation. It's really exciting to be working more closely with the chapters to create a unified vision for what we can deliver to all of those consumers. And then, of course, we also serve the healthcare professionals in the hemophilia treatment centers. Currently, there's more than 140 hemophilia treatment centers across the United States. We see the hemophilia treatment center network as critical for us to achieve our mission. And again, that mission is to ensure that people with bleeding and disorders can thrive. So it's these 3 stakeholder groups that we focus on, and we will continue to focus on in 2021 and beyond. Again, if there are issues from any of these stakeholder groups that you think we're not paying sufficient attention to, I welcome your comments and your input. Next slide. So the global lens, I told you that I would mention those, and the global lens really serve as goalposts for us, as what the benchmark is for us to be able to ensure that we're doing our job. So we want to make sure that we have research that's generating better treatments and cures. We want to ensure access to quality care. Treatment standards and criteria are well established and assist people with inheritable bleeding disorders to thrive. There'll be a role for hemophilia, there'll be safe treatment therapies for people with bleeding disorders. Information and education will be provided. And again, the cohesive network of chapters that provide support throughout our community. And that NHF will continually grow and adapt to the environment so that we can be sustainable in the future. Now, again, these global lens are, as I said, are the goalposts. These global lens will change as we evolve. And as I said, our new mission and vision statements reflect that more long-range plan for the National Hemophilia Foundation into 2030. As we continue on, the global lens will likely also change to reflect that more long-term vision. But these are our current benchmarks for where we need to be at the end of 2021. Next slide. So we have strategic imperatives, and I wanted to share these with you. We've undergone about a 7-month strategic planning process where, again, we've listened to the community to try to understand where you think our efforts should be focused. And we have 6 strategic imperatives that I'll talk a little bit about. The first one is to cement NHF as the premier organization supporting inherited bleeding disorders. I lost my screen here. So the first one, as I said, cementing NHF in terms of the premier bleeding disorder. This is important to enhance the trust of the community, that we can be the trusted partner for people with inheritable blood disorders. We want to demonstrate activities and have programming that support the community. So again, it's important that we listen to you so that we can do that. The second strategic imperative is around aligning NHF in patient centricity. Well, you might ask, how is that not the case? The National Hemophilia Foundation is a patient organization. Well, we want to make sure that everything that we're doing is for the patient and is accessible by the patients. So, for example, it's ensuring that our programs, our website, our materials are available to everybody in our community, including the Spanish-speaking community. So we'll be making an effort to translate our materials, including our website, for people that speak Spanish. The third strategic imperative is about diversifying funding. For us to be sustainable in the long term, we need to ensure that we have stable funding. So we're looking at unique funding opportunities and mechanisms for the National Hemophilia Foundation. You'll hear more about that in the future. The fourth strategic imperative is around building stronger local community. And this really hinges on our chapter network. We want to bring our chapter network closer together so that we can all work more aligned together. The fifth imperative is one that's really important, and that is defining and implementing a research strategy based on community input. We're along this path, and we'll spend a fair amount of time at the end of the presentation talking about what we've done, where we're at, and where we're going in terms of our research strategy. And then the sixth one is understanding, defining, and then prioritizing what we need to do to reach our vision in 2030. So this is really important for us because we've spent a lot of time trying to understand what that blue sky looks like in 2030. And we're going to spend time each year understanding what we need to do to take the steps to get to that vision. Next slide. So here's some of the information that we've learned from that Blue Sky project. We work closely with patients, providers, payers, policymakers, and other partners, including industry partners, as to what it will take to achieve that vision. And there were three areas that stood out: health and social equity, maximizing the value of technology, and sustainability and viability. So I'm not going to go into detail into each of these. You'll hear more about this in future programs, publications, and on our website. But I think you can take away from here that we're going to be focusing quite a bit of attention and resources on health and social equity, technology, and then, of course, sustainability and viability. Next slide. So I'm really pleased that the von Willebrand disease guidelines were published yesterday in Blood Advances. I think this is a tremendous step for the bleeding disorders community. This was an international collaboration between the National Hemophilia Foundation, the American Society of Hematology, the World Federation of Hemophilia, and the International Society on Thrombosis and Hemostasis. This was a long-term project to bring together key stakeholders that are involved in the care of people with von Willebrand disease, not only diagnosis, but also treatment. These guidelines involved two professional organizations, the American Society of Hematology and the International Society on Thrombosis and Hemostasis, and two patient organizations, NHF and WFH. The patient voice is critical in here. And I wanted to emphasize a statement that I took out of the guidelines. The values and preferences for this guideline were considered from the patient's perspective with input from all panel members, including patient representatives. The patient voice in these guidelines was taken seriously and was weaved throughout each of the guidelines. The two publications, I think, are landmark. They will serve our community to advance the care of people with von Willebrand disease, not only the diagnosis, but the treatment. So you're going to learn more about these. Our education team and our medical programs and information team are looking at ways that we can disseminate this information to you, the consumers, the healthcare professionals, and our policymakers as well. We want to make sure that these guidelines are utilized. They're not just something that sits on the shelf. We want our community members to understand what the guidelines mean and how they can improve their care through these guidelines. So again, I'm really pleased about these, and it's exciting to have these types of guidelines. We're going to be looking in the future for collaborations with these same organizations and others to develop additional guidelines about important areas. So if there are gaps in your care that we need to hear about, please let us know. On the next slide, you'll see that we're going to pivot now and talk about NHF State of the Science. Now, what is this? This is creating a national research agenda. Again, the vision is a world without inheritable blood disorders, and that begins with research. The focus for this project is in bleeding disorders. We're going to be focusing only today on bleeding disorders. In the future, we may want to consider a state of the science for blood disorders, where we would bring in experts from other communities, including the patient advocacy organizations, for example, in sickle cell disease or thalassemia or hereditary hemorrhagic telangiectasia or platelet disorders, et cetera. But for today, our focus is on bleeding disorders. Next slide. So here you see that we set a course with the state of the science, and we had a plan. So the first thing was aligning our focus. We want to bring together the inherited bleeding disorders community in our research focus. And I'll show you how we've done that through a number of different efforts. We're now in the process of defining our priorities. We want to set 4 to 6 research priorities and provide a framework by which the community can have an input into those priorities and how they're further developed, with the ultimate goal of fostering progress through collaboration. We want to establish functional platforms and partnerships to encourage research and collaboration on these important aspects that are being identified through the State of the Science project. Next slide. Shows our journey to date. What we started with was the Blue Sky Project, where we had a number of focus groups in June and July. Those focus groups looked at what would it take for you to live the most fulfilled life in 2030. If there wasn't constraints of time, money, or commitment, what would it take for you to thrive in 2030? So we learned a great deal about that, which informed our strategic plan. But more importantly, it provided tremendous input into research gaps that we could start with. The next thing that we did was we sought community input into that Blue Sky. We had an open comment period for people to provide input. You'll hear more about the Blue Sky Project in subsequent presentations. We're compiling a tremendous amount of extremely insightful information currently so that we can fully understand the implications of that work that we've done. The third area that we've done work in is listening. We've listened to patients. We've listened to healthcare professionals. We've listened to the chapter leadership, and we've listened to industry members as well to understand what they think the research questions are that should be approached. We're now compiling that information as well. What we will also do is a community survey. We've recently launched a survey through our chapter network that we hope will provide additional input. So if you have the opportunity to participate in that chapter survey, please do so. Your voice, your input is critically important so that we have a full understanding of what the research priorities are for the inherited bleeding disorders community. So through these 4 distinct efforts, we're really trying to get the community voice, the patient's voice, to be fully represented in our research journey. So on the next slide, you can see the comprehensive approach to our listening sessions. The first part was with patients and caregivers. We had 4 groups with 6 to 8 participants in each. And we had 4 hours of contact time with these groups. We spent a lot of time listening to patients and caregivers. The second was with patient organizations and local chapter leaders. Again, 4 groups with 6 to 8 participants, and again, 4 hours of time together. The insights that we gained were tremendously helpful. We also spent time with healthcare providers. Again, 4 groups, in which some of these had 10 participants. And again, we had a 2-hour session with healthcare providers. And then we just recently wrapped up with industry, where we had 2 groups with 8 participants for a couple hours. And again, the insights are really quite compelling. We were really looking to understand what it means to live with a bleeding disorder. What are the most bothersome symptoms and unmet medical needs? How the healthcare relationship and the treatment experience is occurring. And then, of course, perceptions of different research strategies, registries, observational research, and clinical research. We learned a great deal from listening to each of you. The goals now are to understand the priority areas for research, and of course, any barriers that would prevent completing research in these areas, and ways to increase participation of healthcare professionals and patients in research and enhance their relationships. And then also addressing any barriers to participation in clinical trials. We can only make advances if we continue to have this type of research. On the next slide, you can see the respondent profiles in these groups. So I'm really excited that we had diversity. We had diversity in terms of age and gender and ethnicity and race, which was really important that we have a reflection of our community. In the healthcare professional group, we again tried to have diversity in roles. So we had each of the members of the comprehensive care team represented, so that we did have that type of diversity that was important. And then lastly, we had diversity in diagnoses. We had not only people with hemophilia, but we also had people with von Willebrand disease, platelet disorders, as well as other rare bleeding disorders. I think it's really important that this diversity is emphasized, because it gives us a complete picture of the bleeding disorders community and the needs that they have. And again, I emphasize that there's still opportunity to have input into this through the chapter survey that's currently available. Please participate and provide your input. On the next slide, we'll talk about some of the key learnings that came from these listening sessions. And I've invited my colleague, Michelle Whitcop, to describe this slide for me, if she would be so kind. Michelle?
Thanks, Len. This was from the listening sessions, and one of the things we did for our patient community was to ask the patients who came to present a collage that demonstrated their life today and what they envisioned their life to be in the future. And it was really interesting to see how people presented the wide variety of people, how they presented everything. This was one that I thought was really dynamic. As you can see in the upper left-hand side, you see somebody's ankles shackled. And this was from somebody who had hemophilia, a man, and he felt that pain really shackled him and kept him tied down. And you can see how in one of the pictures there, the changes from the bleeds in his joints, how it changed his body image. And that really created a sense of isolation for him. He couldn't participate in what he considered normal sports. He really felt isolated from his community. And sometimes the issues like the cost of factor, the cost of his treatment, the fear of not knowing if he would have insurance, if he would be able to pay for his treatments, felt overwhelming. And you can see a tidal wave. This felt like this was always overcoming him and would just envelope him sometimes in his fear. So it was very profound, the visual impact that he was able to portray. When he looks into the future, though, he sees much of that changing. While he might be dependent upon medications, he really felt that the future generations would see pain erased away. And he really felt that cure is an option. The other thing that he felt was going to be important for the community was a quick diagnosis and being more engaged in the community, being able to participate in things, activities and sports that he was never able to. And things like insurance were not going to be an issue for other people like they have been for him. And one of the things that he had learned was the importance of being able to advocate for himself, for his family and his community, and the importance from that. Those things were going to give him freedom from that tidal wave. And when we looked at others, it was just really impactful again. One woman in her life today had her as a lioness leading her cubs, but she ended up finding out that she herself had hemophilia. And when she looked at her life in the future, where today she was leading her cubs, in her life in the future, she was walking alongside of them because now their journey was her journey. And again, their vision, their ability to share that with us was just very powerful. And sometimes these images is what we need to see in order to understand that patient journey. So Len, thank you for letting me share that with them.
Thank you, Michelle. I think these were really insightful conversations that we had with the patient community. So on the next slide, we have some of the key priorities that were raised. And there were three areas that came to the surface. One was priorities that transcend bleeding disorders, not the particular diagnosis. Some of those might be things like pain or the ability to make an early diagnosis. Priorities by specific disease or population. Again, this might be whether it's hemophilia or von Willebrand disease or rare bleeding disorders. So we think about specific disease states or populations. And then the third area was priorities related to infrastructure and capacity. Do we have the ability to conduct research? Do patients and family members understand that research? Do we have researchers that are well trained and capable of conducting the types of research that we have? And of course, do we have the sustainability of our workforce to ensure not only care, but that we have the research environment to be able to continue to make tremendous advances in these areas? So on the next slide, you can see some of the themes that emerged in these areas around access to care and women's health, diagnosis and joint disease, the rare bleeding disorders and comorbidities, mental health, physical fitness, understanding registries, underrepresented communities, and of course the clinical trials. I mentioned workforce development and sustainability as a key area that emerged from these listenings. So on the next slide, you can see that our community survey is underway, as I mentioned. The survey is distributed through the NHF chapters to individuals and families. It's separately disseminated through the HCP network. And our goal is to comprehensively include the community voice in shaping our research priorities by collecting input on emerging themes. So again, I encourage each of you to participate in the community survey. If you haven't seen this, please contact your local chapter to get more information about it. On the next slide, you'll see our timeline. And our focus is coming into more clearer view. Right now, we're in the process of establishing working groups. So specific groups that will focus on these priority areas that we've talked about, as well as completing the community survey. In the second quarter of this year, we'll continue our progress and begin the logistics of putting together a State of the Science Summit, which we anticipate will be the week of September 13th. This will be a virtual summit, but we want to have as much input as possible. So we're going to try to do this in a very user-friendly way by having as much material that can be consumed ahead of time so people can really focus and participate in the discussions, being informed about what the issues are. Bring your questions, bring all the information that you need with you at the time of the summit. After the summit, we'll draft a research priority statement that will include what are the important areas. We hope that this will also culminate in one or more peer-reviewed publications that will emerge from the State of the Science. And then the real work begins in 2022 and beyond, where we plan to roll out the research agenda. Now, not all of this will fall to the National Hemophilia Foundation. We look for partners. There might be other opportunities for groups, whether that's the American Thrombosis and Hemostasis Network or the Hemophilia and Thrombosis Research Society, or those groups that we worked with before, like ASH and ISTH and WFH, to take on some of these projects. Some of them might fall to industry, especially those that might be very expensive or be very risky. We can hopefully have participation from our industry representatives to be thinking about how they can participate in the rollout of the research agenda. And then I think the most important community that needs to participate is all of you, the patients. How do we get more patient-driven, patient-led research being done? We've got some great examples out there, and I really want to encourage more patient-driven research as we move forward. So there'll be opportunities for the entire community to participate in this research agenda. As I've said in the past, this research agenda is not just NHF's, this is the communities. I look at NHF as being the catalyst for getting this done, but I really look at this as a community focused project. So with that, I will look at the steering committee on the next slide. So you may recognize some of these individuals, and I think we've assembled a really stellar group of people to lead our steering committee. Dr. Mike Reck from Oregon Health Sciences Center and the scientific leader at the American Thrombosis and Hemostasis Network is the co-chair with me of the steering committee. Dr. Shannon Carpenter, Dr. Jill Johnson, Dr. Barbara Conkle, Dr. Sarah O'Brien, Dr. Stephen Pipe are all members of our steering committee. Dr. Donna D. McKelly, who is also a pediatric hematologist, oncologist, and was at the National Heart, Lung, and Blood Institute for a decade, is a consultant for us. And then, of course, we do have a patient representative, Ms. Esmeralda Vasquez, who is a woman who has a severe platelet disorder, who's representing the patient voice through all of this. And I would be remiss in not recognizing the significant contributions that Michelle Whitcop has done, leading us through this and really spearheading our steering committee and all of the efforts through the State of the Science process. Michelle has been an invaluable member of the team, really contributing tremendously to the progress that we've made to date. So our steering committee has been seated. The steering committee will be meeting shortly to evaluate the voluminous amount of information that's been collected so that we can begin the process of putting working groups together. I invite all of you to think about participating in a working group. You don't have to be a doctor. You don't have to be a scientist. We need everybody. You are an expert in your own disease. You are a subject matter expert in your disease. We need you to participate in these working groups. So again, we look forward to your participation in the working groups, But more importantly, on the next slide, we look forward to you participating in the State of the Science Summit. As I said, the week of September 13th, hold the date. Those have been confirmed. Our agenda and format are in development. This will be a virtual meeting. There'll be cross-community invitations will be extended to soon for participation in those working groups. And again, opportunities for participation will be broad. We're going to have video sessions conducted by the working groups on their areas. We're going to have plenary sessions, but also we want to schedule open discussions to talk about specific priorities. To get your community input is going to be really important. And again, I encourage everybody to participate in this exercise, because with your input, we can make some significant advances into the care that you're going to receive so that everybody in the inherited bleeding disorders community can fully thrive. So on the next slide, I take you back to the vision, a world without inheritable blood disorders. It starts with research. And our research focus for today is on inheritable bleeding disorders, but in the future, we may extend that to other blood disorders. I'd like to end with one comment about Washington Days on the next slide. Washington Days will occur on March 1st to the 5th. It will be a virtual Washington Days. There'll be a series of events occurring between the 1st and the 5th that are listed on that slide. Legislative visits will be on March 3rd and 4th. Again, these will be done virtually. Registration closes on February 5th. I encourage all of you to participate in Washington Days. In the past, we've had robust crowds of up to 600 people participate in Washington Days. We'd like to get at least that number of people participating in our virtual legislative activities. There'll also be advanced trainings through webinars beginning on February 16th. And we have some important issues that we have to talk about. The Affordable Care Act, out-of-pocket expenses, including the accumulator adjuster. We had a plan to talk about the skilled nursing facility access bill, but of course, a triumph for our public policy team and our entire community is that this bill was passed in December and signed into law by President Trump. So we're really pleased with that skilled nursing facility access bill. This was a tremendous amount of work over many years, but it's a tribute to Washington Days and the legislative work that the National Hemophilia Foundation and other patient organizations have done over time to help with these important issues. So we'll be continuing to lobby for the issues that are noted there, as well as for federal funding for our partners, the National Heart, Lung, and Blood Institute and all of NIH, the Maternal Child Health Bureau, and the Centers for Disease Control and Prevention. So I urge all of you to participate in Washington Days. There's more information on our website and how to register there. So I will now end and offer the opportunity for questions. Brett?
Yeah, Len, a lot of information there and to unpack, and I think we've got quite a few questions here, so I'll just start firing away. What is NHF doing to ensure that providers stay in the field of hematology? Also, what is NHF doing to ensure or encourage diverse populations of providers go into hematology?
So it's two great questions. I'll deal with the second one first. I'm really excited that we just recently launched our Jean Marie Lusher Diversity Research Opportunity. This is an effort to really bring new talent into our research community. We're focusing on people that have traditionally not been researchers in our community. The Black, Indigenous, and people of color. This award is specifically focused for those underrepresented communities to get engaged in the bleeding disorders community, to participate in research through this Jean Marie Lusher Award. Dr. Lusher was a champion for educating and training diverse individuals in hematology. And we really look to this award as being part of our spearhead efforts to bring new talent from communities into bleeding disorders. In terms of the first part of that question, I think it's really around sustainability. It's ensuring that we have a sustainable workforce of hematologists, that trainees don't just go into oncology because it's financially more lucrative. We want to ensure that we have hematologists, benign hematology experts who are here to care for our community. The treatments in hematology are not getting simpler. They're actually getting far more complex. And I think this will continue into the future, that the level of expertise that's needed, whether that's for novel non-factor therapies, gene therapies, cellular therapies, and other types of precision medicine that will come to hematology. We need skilled workforce. We need an educated workforce, and we need a diverse workforce as well.
Great. Thanks, Len. Another question. What about those people who are not often heard from, those from communities of color? How are you planning to get the information to them or from them?
Great question. Part of the remit of our new leader in diversity, equity, and inclusion will be exactly that, to understand how we reach people that have traditionally been marginalized, not heard, not felt included in activities within our community. We're going to focus on that. We need your help because much of this is a grassroots effort to try to first identify who those people are that are not participating. How do we access those individuals? How do they want to be accessed or interacted with? How do we deliver information to them? This will be a lot of work that our new DEI person will be leading for us. But again, this will be a community effort. We're going to need the community's help to do this as well.
Great. Thank you, Len. Another question that came in. How is NHF partnering with WFH to address some of the inequalities on a global scale?
Yeah, great question. So I think that it's a tremendous opportunity for NHF to share our experience, our expertise, and our leadership from everything that we've learned in the United States to across the globe. WFH USA is an important organization that helps fund WFH through US contributions. So I would encourage people to look at that because that helps support the mission. But specifically, NHF is working with WFH on a number of different projects. The humanitarian aid program is one. I think that's tremendously important. We also need to have data from not only the United States, but from the developing world and the developed world. So the WFH registry for bleeding disorders is an important component to collecting that type of data, as well as working with our hemophilia treatment centers who want to partner through the twinning programs to help encourage increases in care throughout the developing world. So I think equity is not only an issue in the developing world, it's an issue in the United States, and we look forward to the opportunities to encourage health equity across the globe.
Great. Thanks, Len. One of the questions that came in over the Q&A, and this might be more of a quick answer or comment, but would it be possible to include dentists in future HCP groups?
Yeah, absolutely.
Great, great. Another question that came in through Q&A. Is there a plan in place to secure that women are no longer minimized in accessing diagnosis and treatment?
So I think the VWD guidelines that I talked about really are a great step in that direction. They focus on the importance of the diagnosis in women. The Healthy People 2030 initiative from the Department of Health and Human Services, I think is another important initiative where one of their endpoints is that more people are diagnosed by age 21 with von Willebrand disease. Working with our hemophilia treatment centers, with the American Thrombosis and Hemostasis Network, as well as with other professional organizations, we really look towards opportunities to engage women with bleeding disorders, and in particular, those with von Willebrand disease. Much of our educational programs are focused on women with bleeding disorders, and in particular, von Willebrand disease. our medical education programs will be focusing on medical education around those guidelines as well. So I think you're going to see a lot of activity in this area, but we also want to ensure that we don't leave other groups out. The rare and ultra rare bleeding disorders, platelet disorders, for example, we need to exert the same amount of effort in those areas as well.
Great. Thank you. Another question that came in. How is NHF ensuring that the working groups that are chosen from the state of the science are of a diverse background?
So the working groups are not being chosen by NHF. They're being chosen by the steering committee. So the steering committee has full responsibility for choosing the working groups. And that is one of the parts of the remit to the steering committee, is to ensure that we have diversity in every way that it can be defined. So that's part of the charge that we're giving that steering committee.
Great. Thanks, Len. A couple more questions coming in is, can anyone attend the state of the science?
Absolutely. So the state of the science, as I said, it will be virtual. It'll be open to anybody. And we really encourage people to participate, not in the state of the science in September, but even earlier. It's important to have your voice heard. So there may be opportunities to participate either directly on a working group or indirectly through some of the activities that we will have. For example, if we have a webinar like this that's conducted by one of our working groups, to participate in that, to ask your questions, to be informed, to have, to be the most educated that you possibly can going into that state of the science meeting in September will be really important. Yeah, we encourage everybody to participate, the entire community.
Great. Thanks, Len. One more here, and this might be a little bit more of a comment, but I don't know if you wanted to comment on it, because we do have some educational programs that they're referring to. But can future symposia be more patient and consumer oriented, not just for medical staff and training and education issues?
Yeah, so the purpose of this lecture series is really directed towards healthcare professionals and the consumer audience. There'll be a mix of both. Some topics, what we're hoping we can do is to bring complex topics, for example, cellular therapies. And how can we present cellular therapies at a level that consumers can understand? We need to increase the knowledge of our entire community, not only healthcare professionals, but the consumers as well. So definitely we're looking to that. But I think a lot of our presentations will be geared to what we think the gaps are and what we're hearing those gaps are from you. So if you have particular areas that you'd like to hear more about, to learn about, we want to know that.
Great. Let me check here, Len. So I think that's all the questions that came in. If you'd like to make any closing remarks, please let you do so, sir.
Yeah, I appreciate the attendance today and the opportunity to present. I think this will be an exciting venue for us to be able to communicate with the community. And again, we look at this as a way that to increase your level of understanding and expertise for inherited bleeding disorders. We'll also have a number of topics in there. For example, we plan on having a presentation on curative therapies for sickle cell disease. There's a lot of lessons that we can learn from other disease states as well. So as we go forward, I encourage all of you to continue to participate, and our website will have the future titles for the future presentations very soon. Thank you.
Thank you, Len. I'd like to thank you for taking the time to join us this afternoon. We appreciate your time and expertise as always. I also would like to thank each and every one of you for joining us as well. Please note that this webinar was recorded and will be available to the public on Friday, January 15th at hemophilia.org. Thank you for joining us this afternoon, and have a wonderful week.